Public health officials in Rock and Dane counties are working together to spread the word about a local measles exposure.
On Friday last week, you may recall, the State Department of Health Services confirmed that a Dane County resident has measles.
State officials released a list of locations between April 21st and 22nd when people may have been exposed. UW Health's Dr. Jeff Pothof is here for his weekly visit.
Hi, Dr. Pothof.
Hey guys, how are you?
We have that list, by the way, on channel3000.com of all those places.
Yeah, this is an interesting time. And how long does it take for someone who is exposed to possibly get symptoms and everything?
Yeah, so typically once you're exposed to measles, there is a bit of a period of time where you're going to be asymptomatic, so like 10 to 14 days or so. After that, the first thing you develop, they'll teach you the 3 C's, so cough, coryza, which can be our word of the day, that just means runny nose, and then conjunctivitis, so red eyes, watery eyes, and then a few days after that, 3 to 5 days after that, you typically start developing the rash, and with the rash comes fevers, and really high fevers up to 104, 105 degrees, and then a lot of people will eventually recover from that, but a number of them will go on to get really sick. Back in the early 2000s, the last time we really had like lots of measles cases, about 1 in 5 people that came down with measles was admitted to a hospital.
Yeah.
Oh, wow.
And it can cause brain swelling, can't it?
Absolutely. And encephalitis, it can cause that. It can cause neurological changes where typically kids who get this can have then developmental delay and things like that are lifelong. So it's a pretty serious disease. You definitely don't want to get it if you don't have to.
We know that it's highly contagious, but if you have not been anywhere near the 6 or 7 locations that DHS listed, do you have anything to worry about?
No, I think DHS is going to do a good job of identifying who were in those locations. I think the other thing to point out is if you're vaccinated against measles, you have nothing to worry about. That vaccine is rock solid, 97% effective, so you're good. So really it's, were you in any of those areas and you're unvaccinated against measles, that's when you get in a little bit of trouble because 9 out of 10 people that come in contact with someone with measles will go on to get measles. It's super contagious.
Yeah. You know, what was it, back in 2000, we had reached elimination status, and now we're seeing these cases again. Will we be able to regain that ground?
Maybe, but you know what it takes is because measles is so contagious, the percent of the population that you have to have vaccinated to ensure that a single measles case can't start spreading is close to 95%. So, I mean, that's a really high vaccination rate, and we've come off of that kind of since the pandemic. We're not at that 95%. But if we can get back to 95% of the population being vaccinated against measles, yeah, we can hit that elimination status.
How is measles spread?
Yeah, so it's a droplet, but it's just very contagious. So you want to be in somewhat close proximity to someone who has measles. The likelihood of you getting it if you're not vaccinated is high.
If somebody coughs on you?
Absolutely, you'd get it, yep.
Can we trace this back to, with the pandemic, there was a lot of vaccination fatigue or hesitancy. Is this a result of some of that?
I think so. I think, you saw a lot of folks coming out against COVID-19 vaccines, and that had spillover on, well, maybe all vaccines are bad and I shouldn't get, vaccinated. Back in the 50s and 60s when the MMR came out, up until like the 80s, 90s, no one thought twice. Everyone just got vaccinated. We achieved these really high levels, got this elimination status. Now I think there's more hesitancy in something like measles that starts to create problems.
What is your guidance about this? Can adults get the MMR vaccine?
Yeah, for sure. Adults can get the MMR vaccine. Our kids should be vaccinated against the measles, mumps, and rubella. And really, nothing stopping folks from getting the vaccine if they want to get that done at this time.
It's a 2-shot series, right?
Yep.
And it's only once in your life, and
Yeah.
you're good for the rest of your life.
Yep.
Yeah. So yeah, check your records, folks.
Yep. Look for that MMR. That's the measles one.
Yeah.
And if you don't have that box checked, now would be a good time to do it.
Well, I'm sure we will be continuing to talk about this,
Yes.
unfortunately. So thank you for being here with us.
Good to see
You're
you,
welcome.
Dr. Pothof.
Yep,
Thanks.
same.